All right, Dr. Turner, welcome to the Life on Purpose podcast. We have been talking about doing this for a little bit, the last couple of years, maybe.
Yeah.
But between me moving across the country a couple of times and you kind of growing this amazing clinic, um, it hasn't worked until now, but I'm really grateful to have you on the podcast.
Well, thanks for having me. I always think God has a plan and it's the perfect timing in his eyes. So in that regard, I'm really happy about it, actually.
I am too. I am too. So I guess just a brief introduction, and then I will kind of let you introduce yourself just a little bit more clearly. But you are a doctor at a clinic called Integrative Wellness in West Virginia, which is my home 2 states ago. So I lived there for 17 years, and you've been my physician for the last few years. I see you virtually now, kind of telehealth, but for several years there, I was in your clinic. But it's root cause medicine, which is close to my heart and has done wonders in my life. So, talk to me just a little bit about what you do now versus where you came from.
Wow, that's a big topic. We could probably spend a
I
whole hour
know.
talking about that. But quite honestly, I was trained in traditional medicine, obviously. Got very interested in internal medicine, liking more of the details about medicine. I really enjoy digging down to the bottom line of everything, kind of. I think internal medicine is kind of that way. And so I was very interested in things like nephrology and all those kind of things. And I was emergency room doctor after that because, quite honestly, found a passion in emergency medicine after I was doing internal medicine and finding out that call schedules and things like that didn't really fit my lifestyle. I didn't really enjoy being on call every third night. I kind of liked having a set schedule, so I started doing emergency medicine, and just just blossomed, and I was an ER doctor then for almost 40 years. And basically, I ran several departments. I was ER director at several different hospitals. I would consider it a very long career for an ER doctor just because
I would
most
say so,
ER,
yes.
yeah, most of them burn out after a short period of time. I was able to hang in there for quite a while. I think it's just a bit basically able to handle the stress of the whole job and everything. But in the end, I kept seeing patients that would come in, and I was able to help a lot of people with a very quick regime. In other words, if you came in with a heart attack, I could give you drugs and it would stop the heart attack. Or if you had a stroke, we could get you to the right place, stop either the bleeding or try to stop the clotting, and then just kind of help people. And if you had a bone sticking out of your leg, I could put it back in. We could do all those kind of things, which is really awesome. But we had a huge number of people that would kept coming in for things that we couldn't fix in the emergency room. And it was always the typical, how long have you been on this medicine? I've been on it for forever. I can't get over it. I can't get off of it. The doctors keep giving me more medicine. I'm not better. Can you fix me? And in the end, it wasn't the real place it wasn't the emergency room type of visit. But in other words, we needed more time. It really took a lot more effort to find out the cause. And in medicine, a lot of times, as you know, Brandy, there's not a lot of causation type finding, digging, whatever that gets you to that point. I mean, they're basically there to see you. You're in and out in 5 or 10 minutes. You've got a prescription in your hand. You're going to the pharmacy. And then that process repeats itself every 3 months. And so when people came to me like that, I was very frustrated because I felt bad for them. I really care about people and I really wanted to help them, but honestly, that wasn't the right place to do that. So I didn't really know where to send them, and I basically was telling them always to go back to your family doctor, which they had already been there several times, and they just didn't know what to do. So that kind of spurred my interest in this kind of medicine that we're doing now, which is more integrative medicine. But I guess what really tipped the bucket in this direction was my wife. And one day, just tell you this real quick story. My wife came to me and she said, "Randy, you're a good doctor. Can't you help one of our grandchildren?" And I said, "Well, I mean, yeah, what's going on?" And of course, as a grandfather, I wasn't looking at things like as a medical doctor. I look at things as kids, which we just love on them and hug them and things like that. And she said, "Well, obviously we have a grandson that's autistic." And I was like kind of taken back by that a little bit. I did see this child that was a little withdrawn. He really didn't progress normally. He wasn't talking as he should and all that. And so my wife says, well, can't you find something to help him? You're a doctor. And so I decided that at that point I would do some research. I was a researcher. I basically love research. I was an analytical chemist before a doctor, so I kind of really knew how to do research and all that. So I went down a rabbit hole or two. And I came back to her a couple weeks later. We're sitting at the dinner table, and she says, "Randy, what did you find out to help our grandson?" And I said, "Well, I really didn't find much, but there are some drugs that you can put them on that kind of keep the symptoms under control."
Hmm.
And that wasn't the real solution, obviously. And my wife looked at me the sternly in the
She
face.
wasn't accepting that. I've met your
Randy,
wife.
she goes, I'm not going to accept that. And I'm like, well, what are you going to do? And she said, well, I'm going to study natural medicine. And I was like skeptical. I mean, I was a traditionally trained doctor. I'd heard about these things in natural world and trying to see, my grandmother was a real influential person in my life as far as medicine went. We didn't go to the doctor. My mom and dad took us to grandma, and she would hook us up with, tinctures and different things. And at that point in time, I didn't really know the importance of that, but
Right.
that kind of spurred my interest along a little bit, knowing my wife wanted to study this. So I just said, okay, you go for it, right? So she did, and I'd see her up late at night, and she'd be on the, researching things, and she'd be reading, and she'd wake me up sometimes in the middle of the night with these weird questions about mitochondria and all this kind of thing. And honestly, it just was really kind of a crazy time for us. I mean, she was doing all this stuff. I didn't know anything much about it. But the whole time she's doing these little things with our grandson, and slowly but surely, this kid who was not normally progressing began to do normal things again. And it was like,
Mm.
okay, he's starting to talk more. He's more attentive. He's walking normally now. He's progressing along a path that eventually got him to the point where he was back with mainstream, and he was no longer, quote, on the spectrum or autistic or whatever. And that really, really shook my world a little bit because honestly, I wasn't in that space, Brandy, and
Right.
I was very much skeptical. And so I saw this happen in front of my eyes, and I was like, my gosh, I got to study this more. I mean, there's more to
Sure.
it. So that
Sure.
kind of opened it up to me. And then, to make a long story short, I enrolled in an integrative medicine fellowship, found out that there was places who would train doctors to do that type of medicine, and it was it was a time in my life where I was really changing everything. So I went back to school after almost 40 years of medicine, doing training, and it was like I'm back at this again, but it was very, very enlightening. And then we started doing things with our family,
Yeah.
started a little practice one day a week, and thought we'd help a few people. And it got so busy. And then we went to 2 days, 3 days. And as you know now, we're
Yeah.
we're at it full time. So that's kind of the backstory. So hopefully that kind of
So
gets.
let me ask just a few follow-up questions because um, how much of your foundation did that shake once you started studying kind of root cause medicine, which integrative medicine, root cause medicine, you're getting to the root cause? Because, like you said, when you're in the emergency room and you have people coming in with these unexplained ailments, things that it's not like putting a bone back together or stopping a heart attack or a stroke, kind of these sorts of things. And trust me, I was one of those people. Whenever my health started to fail, um, I would go in and all these unexplained things were happening to me that nobody could help me with. And there were certain reactions that did not feel very great within that system. So what was that shakeup like for you? Because I imagine it was a little upending.
That would be putting it mildly, I would
Yeah,
say. I went through a period of time where I was a little bit depressed, honestly.
sure.
I felt like there was a lot of things I should have been taught in school that I wasn't taught. I wish I would have been taught these things. I mean, now whenever I see physicians coming to me as patients now, I ask them all these kind of questions. And I'm seeing these doctors and I ask them questions that I didn't know anything about, and they don't know anything about either. And the same frustration that they tell me in the office now was the same thing I felt whenever my wife had revealed this in front of my eyes.
Yeah.
And then I started studying these things, and it was like, my gosh, these are things that it makes sense. These are things that, as a physician, as a logical thinker, I could put these pieces together. And then it became like, well, I need to know more. I need to, and there was some of the things had never heard about in medical school. I mean, I definitely, learned a lot about methylation and all these other
Sure.
processes about testing and what's the right kind of testing in functional medicine versus traditional medicine, and all of these things that fit together, Eastern and Western. And I went through a short period of time but what it really did was it woke up this drive, I guess you might say, inside of me where you know what, I'm not going to settle for the average. We're going if we're going to be the purple cow, we're going to be the purplest cow. We're
Sure.
going to make this practice the best practice there is out there to do what a lot of people are trying to do. A lot of people say they're functional, a lot of people, but they still practice traditionally, all
Yeah.
these things, and I wasn't going to settle for that. So I wanted to go to the nth degree to make it the best practice ever. But yes, it was quite shocking to me as a physician to realize there were just things I wasn't taught. And you see Robert Kennedy pushing for nutrition training in medical schools. My gosh, how basic is that? I mean, come
Yeah.
on. I mean, we've got
So you're
very
saying you
little.
didn't learn about nutrition in medical school?
Oh my gosh, very little. And honestly, I mean, come on, you know that. And
Yeah.
honestly, it was just shocking to see, even about vitamins. I mean, what is the importance? We heard about diseases caused by a lack of vitamins, like scurvy and rickets and all these things.
Right.
But in the end, it was so much more to it. And these things can be used to treat people and prevent disease, not just wait for the disaster to happen and then try to put it all back together. And so that's kind of where it was at. But honestly, it took a while. I mean, I probably had about 3 to 6 months where I was just like, I was in a tailspin there for a while. But man, when I started to realize how to get out of it, it was like eye-opening and enlightening and so rewarding. And so I love what we do now, and it's so different.
Well, I'm grateful just because it was the kind of care, and again, so you and I, you've been my doctor for several years now. You have seen me at my absolute worst, and I will say, I think I appreciate what you do. A, because like you never give up, first of all, you never stop digging. But secondly, I had never had a physician where when I said, well, why? Why did this happen to me? That you didn't have some sort of explanation or at least something to talk through to say, look, we can point to this, and this. Before it was I couldn't get anybody to really care about the why. It was
Hmm.
just, well, we'll just wait till you get really bad and we'll medicate you, which was not acceptable to me. I don't operate well like that. I
Yeah.
just don't. Um, I'm kind of tenacious in the fact that I want to understand then I want to fix it.
Yes.
And so I had finally found somebody who was willing to work with me on that level. And I will say that's what I appreciate most about you as a physician because you were willing to work with me, if that
Right.
makes
I love
sense.
that. Well, I mean, you were a perfect fit for us, Brandy. I feel like in the end, a lot of our patients are so frustrated with traditional medicine that they come to us with no answers. I
Right.
mean, and you were asking the question. A lot of people don't know to even ask the question. I mean, they just
Right.
take it for granted that the doctor, when you tell them your problem, they're just going to give you what you need to fix it.
Right.
And we have to change that mentality. I mean, the whole thing about medicine in general is that we need to think about root cause effect for everything that we do. I
Yeah.
mean, we are created by a creator who with intelligent design. If that design does not go as planned. In other words, something starts happening and there's a problem that develops, whether it's thyroid or whatever,
Mhm.
then there's a cause behind that. It's not enough just to say, oh, your thyroid's bad, take this pill.
Right.
You have to really know why it got to that point. I mean,
Sure.
why did it get bad? Why, if you can fix that, it's like how the analogy is the tire that keeps leaking air and you keep putting air into it every week, you never fix the hole. I
Right.
mean, that doesn't make sense to me. And
No.
so in the medical world, the same thing occurs all the time. We have these people that are really care. And I do think doctors care. I don't think I mean, there might be a few out there that are non-caring, but they're just not trained to do that.
Yeah.
And honestly, that's the failure of the traditional medical training. And I felt like I got really good training. I mean, I was on par with all the other doctors. Felt like I was very successful in my career, but
Mhm.
honestly, never getting to that point where chronic disease processes, which most traditional doctors can't fix. They just tell you you got to manage it, right? You
Right.
can't like if you've got Hashimoto's disease, you've got Hashimoto's here, take your thyroid medicine. I
Yeah.
mean, it's not like that. You got to delve down into what caused that to begin with. If you can find the cause of things, you can fix it. If you can find the
Right.
hole in the tire, you can fix the hole, quit putting air in it every week, right? And so that's the whole way that we practice. And the why statement is our mission statement. We've got to get to the root cause of these things using the things that God gave us to do that,
Sure.
whether it's nutrients, taking toxins out of your body. It's pretty simple formula. If you've got toxins or something that's burdening your system that's not allowing it to perform efficiently, then you're going to have dysfunction and disease. And that, in the end, is what causes these problems. So you have to get to that level. And so, yes, it does take some digging to find the roots,
Right.
but you have to get there. And if you never get there, you're never going to fix it.
Well, and what's interesting, so I remember my first appointment with you in the intake. Oh my gosh, it took me so long. It was
Yeah.
so thorough. um, on just what my lifestyle was like, what my background was like, all of it. And then the very in-depth testing, which
Yeah.
again, I had never had somebody who was that in-depth with that process because,
Mhm.
I've talked about it multiple times on this show, but just as a refresher, I was 33 years old when my symptoms started, and they were very unexplainable. It was during a third pregnancy, which I ultimately ended up losing in the second trimester of that. And then it was just a cascade of terrible symptoms that nobody could explain, or was very even curious about, to be honest with you. There was a lot of, oh, well, it could be depression, or it could be this or that, but none of it felt right to me. So again, I will be 43 at the end of this year. So almost 10 years since the onset of this. And if you would have asked me at 33, would I feel the way that I feel right now, with some bumps in between? Don't get me wrong. I would have told you absolutely not. I felt very bleak about what the rest of my life was going to feel like. And I try not to cry telling this story because I remember that feeling and that I felt like nobody was listening or even willing to help me. And I didn't want to spend, I had young kids and, we had a very busy life. I did not want to spend the rest of my life feeling the way that I felt back then. It felt very hopeless. And I've sat in your office with that same feeling,
Yeah.
but leaving always, every single time with hope. And ultimately, everything that you asked me to do, every amount of testing came back with some sort of a aha.
Yeah.
And I feel great at almost 43. Minus
Yeah.
some, we've talked about some hormone stuff. I am kind of that age. But, you know, it's one of those things where it gave me control
Yeah.
working together. So the tests that you asked me to do, the explanations that you would give me, it was teamwork. And so I think that's kind of also one of those pieces that's missing in healthcare today is that working together because it's on me ultimately when I leave.
Yeah.
You can give me all
Right.
the ahas and answers and here are things that you should probably be doing to help yourself. Ultimately, that's on me, which is
Right.
again why I decided to do what I do on the health coaching side to walk alongside people who will need that extra support along the way once they leave an office like yours.
Exactly.
Do you find though that you will have people come in wanting this kind of help, but have a hard time getting over that hump of kind of being stuck still in that traditional mindset of just
Yes.
wanting a quick fix?
Yeah, I think that the whole point about things that occur naturally in your bodies, they don't usually occur overnight. And
Correct.
so when you tell someone that you need to start this process of getting better by changing these things, obviously, if they don't do it, I can't go further to help them because I think at that point I usually make a statement which sounds a little crass. I hope it doesn't, but I can't care more about your health than you do.
Right.
And if you care about your health and you are willing to be coachable, which I mean, I would say 90% of our patients are, you're going to get the results that we expect. Now, why am I so sure about that? It's because this is all based on science. I'm not there guessing about what deficits you have. I have ways to check you to determine what you need. And then I know we're going to get results because science backs up that.
So
So,
let me ask you about kind of like the specific testing we're talking about. Someone like me, and I'm happy to talk about my process, but someone like me comes in with, um, I guess at that time, like when I was at my lowest, unexplained anxiety, insomnia, joint pain, hair shedding, pregnancy loss, overall just fatigue, heart palpitations, blurry vision. I could keep going.
yeah.
Those are some of the main ones. Someone like me comes into your office. Where do you start?
Oh my gosh, that is the typical scenario of probably most of our patients, but
Sure.
they always have more than one thing going on, and you have to start almost always, you have to start with inflammation as a starting point for everything. Inflammation in general in the body leads to disease. It upsets the natural processes in the body. So you have to look for what causes inflammation. And if you can find those causes, then you can start to implement things which are going to start with the most basic things of all. And honestly, we've changed this a little bit over the years, Brandy. I mean, when you first came in, we talked about gut health as the number one priority, and you have to have a healthy gut because 70% of your immune system at least resides there.
Right.
And if your immune system gets burdened by some bacteria or dysbiosis or whatever, nutrient deficiency, then you're going to have inflammation for sure. And inflammation, as you knew,
Yeah.
eventually leads to autoimmunity and all these things, which causes cascading chronic inflammatory response syndrome, which has no good end to it
Right.
unless you change something. So for us, we're looking for the actionable items which are changeable, which are in every person, which can be or cannot, could be wrong. And basically, are they or are they not able to detox properly? Can they absorb nutrients efficiently? Is their gut healthy? Do they have leaky gut syndrome? Do they have a healthy diet? What's their sleep patterns? And the whole reason you filled out that very long intake form was because all of that matters.
Right.
And I had one patient, and I don't think it was you, that said, I don't know why doctors ask me to fill these papers out because nobody ever reads them. And I would
Oh,
say
it was
that
certainly not me. I
in
happily.
most doctors' offices, that's probably true. I mean, you get an intake form, and
Yeah.
most of the time you go in to see the doctor, and he hasn't even looked at it, not one
Right.
time.
Right.
And what people don't realize about our practice is the very first time I ever saw you, I had already spent probably an hour and a half to 2 hours on your chart,
Yeah.
looking over that paperwork that you filled out, making notes, going over that in detail, making things say, here's where these puzzle pieces fit into this practice.
Right.
So I liken this to having a box full of puzzle pieces that are all in one box with no box lid to help me to know where these colored pieces go. In other words, the puzzle pieces are all apart. It's you as a broken person that has all these conditions, which you have anxiety, insomnia, hair loss, all those things. And those puzzle pieces do fit into this puzzle somewhere, but
Right.
where do they fit? Well, I've got to turn the box, open it up, dump them all out on the table, and the first thing you do is look for the straight edges, right? And so
Mhm.
that's what we did the very first visit that you came in. In my practice, that's what I do.
Right.
I'm taking these puzzle pieces, I'm looking for the things that fit kind of together that's easy to put together. That's the easy part for me. That takes about an hour and a half.
Right.
So the first visit you were with me, you were there for probably longer than that because we usually spend longer than that with patients.
Yeah. I would say
And
it
we
was
were
probably a couple hours for sure.
yeah, we were putting those puzzle pieces into a framework. Now we didn't tell you that because we don't have to tell you that maybe, but we have to have some framework to what we're doing. So
Right.
we're looking for things that go together. In other words, does the gut health then lead to things in the brain which causes anxiety? Are you having anxiety because your immune system is upregulated? Do you have something in your gut that's causing you not to absorb nutrients properly? Do you have a nutrient deficiency? Are you a poor methylator? What are your genetics which leading to these things which are causing these weaknesses?
Right.
And so testing wise, to circle back to that, I mean, definitely involves some testing. And I can tell you of all the testing that we've done, I would say that the genetic testing that we do in our office is probably one of the most actionable items that we've ever had.
I would absolutely 100% agree. I keep mine on my desktop. We've also done my daughters. I plan to do the other two, the boys,
Sure.
at some point. And I will refer back to that often
Yeah.
because I will say it was probably one of the tools that helped me the most
Yes.
because it was like, oh, okay, this explains so much, and this is
Yeah.
what I have to do. It was like a
Well,
blueprint. It was an
it's a no,
absolute blueprint.
so that is something you'll have the rest of your life. You're going to do it once in your life. You have the blueprint. I call it like the owner's manual, right? So when
Mhm.
you come out of the womb, your mother should be handed the baby with the owner's manual. That make life simpler, right? But they
Absolutely.
don't do that. In the medical world, the owner's manual, the blueprint, so to speak, is the genetics. But, genetics they're not the end product, right? So
Right.
we have to keep that in perspective. Some people might go down this, and I've seen people with podcasts online talking about methylation and how you're a poor methylator, and let's just methylate you and you'll be fine. It's not that simple. It's much more complicated than that. We look at several gene sequences, all of which has some actionable item to it. I can't change the color of your eyes or your hair color that God gave you or whatever, skin tone or whatever, but
Mhm.
I can change the epigenetic expression of certain genes, which can upregulate certain enzymes, which then will cause the processes to occur the way we want them.
Right.
That's called epigenetics. So if we can epigenetically change the expression of certain genes through the use of just basically nutrigenomics and lifestyle changes and things like that, then you can actually prevent disease and treat disease that no one has been able to treat before. That's why it's so important.
And it really is. And like I said, it was extremely helpful for me because again, I was a poor methylator, am a poor methylator. So B
Mhm.
vitamins were extremely important. The things that I put in my body or on my body and all, all around me is extremely important. Um, and it was, I don't want to say it's as simple as that, but it kind of felt as simple as that. It was,
Yes.
just a few things that I had to tweak to start to feel better. And
Right.
then when you start to feel better, you're like, wait a minute, it's really
It's an
eye-opening.
yes, it's an
And
eye
I
opener.
didn't, other than low dose naltrexone to help control inflammation, I've not had to use any other prescription meds in
Right.
my 10 years of this journey.
That's amazing.
Um, and people are somewhat shocked by that, but it's just kind of a testament to this type of care and this
Yes.
type of medicine. It's sometimes hard to get people on board with, okay, that doesn't, after decades and decades and decades of the kind of medicine that we've been presented, the fact that there is another way, and it was the way before the way. Um,
Yes. I love that. Yeah, well, we have in our office the Freedom Jar. This was probably came on, maybe it was after you came, I don't know. But it's a big jar. It's about this big around. And
Mhm.
in that is medication that patients were taking when they came to us. In other
I
words, we
love
call it
that.
the
No, you
Freedom
must have
Jar.
started that after I left.
Yes, and we dump all the meds that they were taking in there. Now this jar has got this building like big pile of drugs in there, and basically it's our way of and we take a picture of them dumping them, and they always
Yeah.
have a big smile on their face, and they're feeling so good, and they're like, "Oh my gosh, this feels so relieving to get off of
Yeah.
these drugs that I've been on for years." And that's not really done at a traditional office, right? And so I feel like they change medicine sometimes at a doctor's office, or they give you more of something or add to it. But I rarely ever see people taking them off of things. Or how can we get you off of an antidepressant? Or
No,
how
and
can we get you off?
it's interesting you say that because my experience, and I will to this day, and I'm sure people are tired of me telling this story, but I don't care because it was my I'm done moment. But I had it was a primary care physician. I didn't see them regularly just because even before all this, I didn't really like to go to the doctor's office anyway. But it was in that period I had lost this pregnancy. I was absolutely devastated by, and I had all of these cascading symptoms that nobody could tell me about. And I had gone the functional medicine way. It was a chiropractor who actually got me the results before you opened your office.
Mhm.
And I took him to her, and she said, well, we'll just wait till it gets so bad that you need to be medicated. Because at the time I had antibodies, but my thyroid was still
Right.
somewhat
Working.
on level.
Yeah.
And I remember thinking, like, that's it? There's nothing
Yeah.
I can do in the
Uh,
meantime. There's nothing I can do to prevent medication because, in general, I don't like medication, period. I don't even like taking ibuprofen or anything like that. I've kind of always been that way. But it seemed crazy to me. Like absolutely crazy to me that there's absolutely nothing I can do.
Well, yeah, it is crazy. I mean, if you think about it, I mean,
I
that's
don't want
logically
medicine.
speaking.
I just don't.
Yeah, this is the typical scenario. I mean, we
Right.
see these people come to us and they've had these symptoms for a long time, but they
Mhm.
don't really have any findings on lab work, right? You go in and they say, oh, your TSH is normal, your T4 is normal, your T3 is normal. Yeah, but doc, I got these antibodies. What about that? Well, they're not doing any they're not a problem for you right now. Let's just watch it and see what happens.
Yeah.
Well, that's to me like having the tire that's going, slowly going flat and you're waiting for it to go completely flat before you fix it. Like that makes no
Right.
sense to me whatsoever. So many people are in that same boat that you are, Brandy.
Right.
And honestly, that was the saddest thing about my case talking to you is that you had reached out and you actually had good questions. You asked doctors about things like this, and you
Right.
got the same answers over and over again.
Right.
It's like we're just going to wait and see, what we
It was
can.
kind of the lack of curiosity that maybe put me over the edge just a little bit. Um, because again, I was willing to do whatever. I wanted to feel better. I wanted to feel good. I didn't, like I said, I didn't want to imagine my life feeling that way for any longer than it, it had to. And so I was a willing kind of party in this. And I just wasn't. I cared more than they did, which I guess, is a good
Yeah.
thing, but also I needed them to
Well,
care just a little bit more or
well,
have at least some curiosity of
it's a
why.
good thing. It's a good thing until your doctor doesn't care enough to make some changes that's going to prevent disease. That's the problem. And I think when we start seeing people that come and listen, this is not new. The things we talk about have been around for a long time, but are
Right.
not necessarily new. Now we do
Yeah.
some unique testing and things that's fairly new. But honestly, the people that come to us that have symptoms like you had, that's been to many doctors that can't get to the bottom of it, when they leave, I can tell you that most of them shed tears in the office because they finally found somebody that's willing to listen to say, okay, we're going to fix this.
Yeah.
And when you get that definite from us, I'm very conscientious about it. I'm going to dig until we find the cause. And if we can find that cause, we're going to help you. And if God's plan is for us to fix it, it's going to get fixed. And we're going to rely on that. We're going to pray for you. We're going to also do all the testing that we need that we know to do.
Mhm.
We're going to ask you to do the things that you're going to do at home.
Right.
And when people do that, they generally get better. And honestly, that's the biggest thing of all. And when you get that hope in you and you can look in the mirror and say, you know what, I'm going to get better. I'm not going to be like every other time
Right.
I've been to the doctor where I come out with no hope. I'm going to look in the mirror tomorrow and now I have hope. And that is one of the biggest things toward getting better. And you know this with coaching is that
Absolutely.
if you believe in yourself, you have a much better opportunity to succeed. And that is exactly what we teach our patients is we empower you to use the God-given things that he gave us to
Hmm.
heal the body. And we know it works because there's science behind all of it. We're not guessing. And
Right.
when we don't have to guess, we know we're going to get results.
Yeah, and I agree. And like the hope piece and the empowerment piece, I think were absolutely paramount in my particular case. I needed to know that there was hope. I needed to know that somebody was going to really work with me and dig to answer these questions. But then the empowerment piece was that then it was on me to take control and that
Right.
I had control of it. This wasn't something that just happened that I had no control over. And I think that's, especially in the coaching side of things, when I specifically work with women. Um, but that empowerment piece, once they realize that, oh my gosh, this is in my hands just as much as it is in anybody else's, and I can take control over my life and my health, then you see this absolute transformation.
Oh,
And then that teamwork between your practitioner and yourself.
mhm.
It's amazing. It's
It's
absolutely
amazing.
amazing.
It's life changing. That's how amazing it is. That's the part that I love the most about my job. And I get
Mhm.
to see people who have no hope, get hope, and then make the changes that actually gets them to where they want to go. And they have a new lease on life, basically.
Yeah,
They've gotten out of the hamster wheel of going to the doctor, getting the drugs, going to the doctor, getting the drugs, going to the pharmacy, all
right.
this thing. Get out of the hamster wheel. Now we have, oh, I don't need that anymore. It's amazing because I go over
Yeah.
the things that you filled out like at the beginning, we'll do
Mhm.
again. And the symptoms that they had that they came with, they no longer have. In fact, some people forget about it. They're like, oh, yeah. I ask them a question. I mean, do you still have 5 headaches a week? Oh, no, I don't. Did I have that before? Did I write that down? Yes, you wrote that. That was one of the things that you came here for. And
Right.
it's amazing to me to see these changes in people. And I love that. That's why we do what we do. And to
Mhm.
go back to the why, that's one of the whys, right? We want to see you flourish as an individual with the God-given ability to heal, which is what he created, and then without the need for pharmaceuticals, if possible. Now, am
Absolutely. And that's not to say you're against
no, not at
pharmaceuticals.
all.
If they're needed temporarily or long
Yes.
term or whatever, that is still a tool that you use, correct?
Absolutely. I mean, I still have, patients that are using, thyroid medication, and there's things that some people you have to have them because their thyroid doesn't work until it can be a bridge. I can say that. I mean, I don't
Yeah.
think that every patient that's been on thyroid medicine in our office is still on thyroid medicine.
Hmm.
We've had people that got off of it, believe it or not. And that's something that nobody talks about.
Right.
But honestly, that can happen.
Mhm.
And, a lot of these drugs that are people have been put on, they can be a temporary help. And honestly, as a rescue, I think drugs can be helpful. And honestly, that's the part that I really like about traditional medicine is that we can give medicines to help people. When you're in dire need, I mean, and you came into the hospital and if you needed sewed up and you had a bad injury, I could give you drugs that would take the pain away until we got things sewed up and get you back together. But
Right.
it wasn't something you need to be on the rest of your life. I mean,
Sure.
if you're on drugs the rest of your life, there's something wrong. I mean, unless it's something that's necessary, like a thyroid medicine,
Right.
but blood pressure and all the things that people have never gotten to the bottom root cause of, if you get to that root cause, a lot of times you can fix it and then they get off of medicines. And therefore, the freedom jar exists for a reason. And that's why it keeps getting, fuller and
Fuller
fuller.
and fuller. I love
Yeah.
that. No, I did not know about the Freedom Jar.
Yes.
I need to make a trip back, obviously. Like
Yeah,
I
bring
said,
them. Bring
West
them.
Virginia was my
We're
home for
at.
17 years, and I've seen you on telehealth every other
Yes.
state since.
Come back.
So I do, but I do want to say something about your office specifically, um, because going to the doctor is somewhat
Mm.
depressing.
Yeah.
And it has been in the past. Your office, and I credit Cheryl with a lot of this, your wife, is probably one of the most comforting and comfortable experiences of seeing a physician I think I've ever had. It is
Yeah.
beautiful and
Yeah.
it's welcome. It's just it's such a the energy. I wish I could explain it. I mean, a lot of people have been there. Your practice skyrocketed for
Oh, yeah.
obvious reasons because what you're doing is helping it works. Obviously, it
Yeah.
wouldn't have skyrocketed as quickly as it did if what you were doing was not
Yeah.
working for people,
No.
obviously. And I don't know that even you thought it was going to skyrocket the
I
way that it
had
did.
no idea. Honestly, Brandy, if you would have told me at 5 years in or 6 years, whatever we are now, that we would see patients from majority of the United States and people from out of the country that come to a small town in West Virginia to see a doctor that really, I mean, it's honestly, it's humbling, but at the same time, I've asked every single person that came to my office that came from California and Utah and Nevada and Montana and all these places,
Yeah.
why did you come so far to see me? I mean, my gosh, there's got to be doctors doing what I do in these towns and in some places even more so than in West Virginia. But they all have the same story. I knew somebody that came to you.
Hmm.
I have the same problem they have. I can't get better. I've been to all the doctors I know to go to in my area. I can't get better. I'm coming to you because my friend who came to you got better and they're no
Hmm.
longer on their medicines. They're doing great. They're thriving. And look at me. I need help.
Yeah.
And so that's the story that we hear over and over again. But
Right.
yes, the reach that this has been very much not expected, honestly, but very welcome, I guess you might say. And I believe it's because God has blessed us with a really busy, uh, and part of that is the office when you walk in, and you're correct, Brandy. Well, my wife is basically an interior decorator at heart, I guess you might say. But when we started putting this thing together and we said, hey, we need to get some lights, we need to get some furniture, she
Hmm.
started bringing things in, and I'm like, wait a minute, that doesn't look like a light, Cheryl. She goes, no, that's a macrame light. I'm like, well, what the heck is that? I don't even know what that is. And she goes, I do not want this office to feel like a medical office. I'm tired of going to doctor's office. It's sterile, it's cold, it's not friendly, it's not welcoming. And I'm not gonna have a practice like that. And so my wife is an integral part of my practice, obviously, because she's been
Yep.
studying natural medicine much longer than I have. And she still is working there, and she's the one that gets all the credit for that. It definitely wasn't Dr. Turner. It was Cheryl, and Cheryl is the one that you can thank for that. And I will definitely pass that on to her that you said
Oh,
that.
yes. I mean, it is a huge part of the experience for sure.
Well,
It's very
and
welcoming.
if you walk into a place and immediately you feel like it's welcoming and
Yeah.
friendly and healing, we want you to feel that right off the bat. We don't want you to walk into a place that feels like you're going to get stuck with 17 needles and
Right.
walk out, with a limp. I don't want that
With
to
more
happen.
problems than you showed up with.
Yes, I don't want that to happen. And so, I'm very conscientious about that. We want to provide a concierge experience for our patients. I think they deserve that. You're trusting us with your health, and I want to take that as serious as possible. And we want you to
Yeah.
know that right off the bat.
Well, I do think that, and this is just me being an observer, it's kind of how I operate. I think you and Cheryl both, and whether Cheryl was the catalyst or how that all worked, something was tugging at you to do this work, and you definitely answered a calling because the amount of healing that you see coming out of that office. I've had my own family, my parents have seen you, my daughter. Um, I need to get Josh there.
We're working on them.
He's more stubborn than
That's typical men, though.
I
I
know.
see it all the time.
I know. But you definitely answered a calling, and I think that's why you operate the way that you do and have such passion behind it because it was always meant to be there. And that's
Yeah.
just the way I see it. That's the way I feel. You're not changing my mind.
Oh, I appreciate that. Honestly, I think if you have passion about anything that you do, you're going to do better at it. And it shows. I've listened to some of my wife talking to people at the office, and I was just blown away by how passionate, that she is about everything she does.
Yeah.
And then it comes across from us too, because honestly, and I try to instill that on every employee that we have. I mean, I really care about people. I really care. I want them to know that we care about them, even
Yeah.
if I'm telling you, the studies prove this out over and over again. Some of the worst doctors probably get some of the best results. Why is that? Because the people that go to them think they care.
Yeah.
And that's psychological, obviously. We go in beyond that. We have science behind it all, but honestly, that's a big part of it. And if people come to you and they feel like you care about them, the chances that they're going to get improvement is very high.
I agree
And the
with that.
same
Yeah.
thing. I mean, same thing with you and your business. I'm sure if you talk to people and they think that, man, gosh, this girl's really listening to me, they're going to get better. They're going to get improvements.
Well, absolutely. And I had recently, and I don't think I realized that until recently. So I had recently left a contract job that I was contracted through, so another a business. So the clients that I had were through this business. And I ended up stepping away from that job for various reasons. But one of the clients reached out to me. Had been a couple weeks away because we would meet weekly. And she was on this healing path, and she was in the UK. So, time frame, like our time zones were all messed up, but she would reach out to me at these really odd hours over social media. And she said, the work that we were doing together was really helping, and I really, really I
Mhm.
miss that. And
Yeah.
it was needed, and I don't feel like our work was done. And it broke my heart, but it just kind of they know when you care and they
Oh,
know
yeah.
when you're listening to them and they know that you're going to do anything to help them
I love that.
answer this question or dig a little bit into this or guide, maybe tweak the path we're going down just a little bit. But I think there is definitely an energy behind working with someone who genuinely wants to help.
Yeah, I agree. And I think you've had people on your podcast before talking about energy medicine,
Mhm.
Ayurvedic medicine, and different things like that.
Sure.
Your body is an energetic field, believe it or not. And
Right.
if there's an energy that's coming from another source that's getting, you can tell when you walk into a room whether it's a friendly environment or not. It's just a
Absolutely.
feel. And that's one thing that we really try to to instill in our patients is that when you come to us, we want you to feel that energy right off the bat, that it's a positive energy. It's not a negative energy. It's a healing energy. It's not a disease energy. It's basically to try to help you to get better quicker. And I want them to feel that. And that's why we've really taken steps to really institute that in our office. I mean, we've even taken, going to try to block EMFs and just all kinds of other things. But some of the healing techniques that we use involve, frequencies and different things like that, which sounds a little woo-woo to some people. But I can tell you that that stuff really works. And if you think that Chinese medicine that's been around for years, thousands of years, doesn't work, try to explain that to people that get better by using it.
Right.
And
I had someone on the podcast very early on. It was probably 4 or 5 years ago now. Um, we discussed Chinese medicine, and she was a practitioner, and all of the training that she had done, it was very fascinating. And I think to be able to pull from all of these different healing modalities and methods, why
Mhm.
not use all the tools that you have at your
Exactly.
disposal? I mean, why shut off anything that could be useful
I agree with you
as woo
100%.
and I don't even think much is woo anymore, to be honest with you. I
Yeah.
mean, from the time I started seeing you to and the time I started the podcast and really talking about all of this and kind of everything that I had been kind of seeing and was working for me, it was probably woo woo back then, which was not that long ago, to where we are now. I have nothing but hope that the train will continue
Yes.
down the path. I have been able to get more and more of my friends and family,
Mhm.
etc., on board. I have also had some pushback also, but whatever, explaining to somebody that I've had this autoimmune process for how long now, but I'm not on medication, so it must be working,
Yeah.
right?
Something's
I
working.
will
That's
take
right.
my way over yours.
100%, no doubt about it. And that is right. I mean, so many times people just don't realize there's another way.
Right. Right.
And knowing the other ways really matter because those other ways can be something that can be curative. I mean, we're not talking about, somebody that has autoimmune that continues down to the path of ending up with, ulcerative colitis and Crohn's disease.
Mhm.
We're talking about people that headed that way that got completely well and no longer take any kind of medications, have no flare-ups for years.
Right.
And now and doctors that see them are saying, "How did you do that?" You know, you can
Now,
call them.
did you have any kind of pushback? Because you started your practice when it wasn't super popular. I feel like again with Robert F. Kennedy Jr. and the Maha movement, and you see a lot of big names with root cause medicine and that movement kind of being very vocal that it was not when you started your practice. This was years ago. Was there
Right.
pushback? I mean, what was that like?
It was kind of interesting in the beginning because I didn't really think that we would be able to make a practice of it because I really felt like it was such a niche area, I guess you might
Mhm.
call it at the time. And this was like right around the time of COVID that we got this practice started.
Right.
And I think that was a springboard. I think COVID was a springboard to making this all happen because honestly, and I know that when people started seeing all the controversial things about COVID, about wear a mask, don't wear a mask, get a vaccine, don't get a vaccine, if you get the vaccine, you won't get it. Yes, they did. If you got the vaccine, you won't get it as bad. Some people died that got the vaccine. I mean, so many things were just not making any sense that people started questioning the establishment of this
Sure.
traditional medicine model that is out there. And not that people didn't already feel that because they were already feeling it anyway, because they just felt like, what am I going to do differently? There's no other option.
Right.
And so
That
when
kind
we
of just
started
shone a
practice,
bright light on it, I feel like. It just
yeah, I think it did.
highlighted some of
It
those
did. And
cracks.
I think the pendulum started to swing the other way.
Hmm.
Had already started to some degree, but it just continued then, and it sped up, I think,
Hmm.
because of it. And nowadays, it's not uncommon for people to go to the doctor and ask questions. And most of the times that never happened. I mean, doctors basically told you what to do and you did it. And if you didn't do what
Right.
they said you're not fit for my practice. That's
There was
it.
a lack of curiosity. Yeah. Yeah.
I do feel like there's a lot of change now, but yeah, we started. before this pendulum got to swinging as hard as it is now. And
Right.
I'm really thankful that we did, because honestly, that's the part I really like about it, is that now, I don't have to go out there and beat on doors to get patients. I mean,
No.
they just come, and we don't do a lot of marketing. I mean, there's a lot of pieces of this puzzle. Our business coach that we have was shocked, and he wanted to know what our business marketing budget was, and I
You're
said we don't
like,
have one. And he's like, "Well, how do you get patients?" I said, "They call on the phone. I mean, that's how we get them. People send them to us."
because they
And
were desperate for care and quality care.
yes,
Um,
and it
it was
matters.
one of them. I know what that's like. You're desperate for somebody to genuinely care and to genuinely help.
Exactly.
And again, I there was it wasn't, yeah, you're right. It wasn't necessary for you to try to bring people in. It's
No.
just it's what people had already been yearning for, which again,
Yeah.
you just fulfilled a calling. Okay, so let's go back to kind of what we were talking about before. What can someone expect as far as testing? What kinds of testing do you provide? Because so I pulled up your website again. It'd been a while since I had been on it. Um, but you guys say, let's see, that you look for a root cause for symptoms of nutritional deficiencies, mood disorders, GI dysfunction, fibromyalgia, problem sleeping, PCOS, brain fog. I mean, the list
This
is
is long.
endless. I mean,
Yeah.
it's endless. Any ailment that most people have, um, this would be the kind of practice that you would want to go to kind of dig deeper to get to the root cause of that. So, what kind of testing do you provide for kind of this overall spectrum of symptoms that
Well,
people are dealing
yeah, I
with?
think, well, we alluded a little bit to the DNA testing, and that report comes back at about 80 pages. I mean, I know people out there
Yeah.
doing genetic testing, and they get checked MTHFR gene, and that's basically it, or some other couple, two or
Hmm.
three other things. We're not talking about 23andMe and Ancestry.com or these companies that do these tests. We're talking about specifically generated testing that is actionable items based on nutrigenomics primarily, but also other like things like neurotransmitters and things like that. So that's one of the basic tests that we'd recommend for most people. And it's a test that probably will help 90% of people that do it, honestly. And a few that fall outside that, there's some connections to the genetics still as well, but that goes a little bit deeper. Then we were really interested in functional testing. I have uh, struggled with the fact that we know now that traditional blood testing for like CBC chemistry panels, thyroid, et cetera, is only minimal to try to figure out what's going on. And the reason I say minimal, it's necessary because I'd still do those kind of tests, but it's not the final thing. So if we know that you've got something on with your thyroid, is there a better test than just a T3, a T4, and a TSH? And there is. I mean, there are functional tests out there that can test these things. So if you know about doing those kind of tests, and I was awakened to that not in medical school, but after 40 years of doing medicine, that there's a test for a thyroid that you can check the function of the thyroid without putting a needle into the thyroid gland, and I
Hmm.
didn't know that existed. So I found out about functional tests, and there are plenty of those around. Organic acid tests, which will then point to the way things work inside your body, not just looking at do you have B12? I mean, what is my B12 level? I can't tell you how many people come to me and say, I checked my B12, it's normal. But they only checked what the B12 level is in the blood. What about your body using B12? Do we want to know if it's using it or not? It's sort of equivalent to the gas tank in the car. If the gas tank is full, does that mean the engine runs? Absolutely not. We need to look at the engine to see if the engine's going to run before we put the gas in the car. So you might have a full tank of gas, but not being used. So the B12 in your body may be normal, but your body's not using that B12. Then we look at organic acids to say, are you using it or not? And we can look at things like methylmalonic acid in the blood. We can tell you if you're using it or not, and that'll tell me if you're using B12. So I tell people all the time, including doctors that come to me now, and I say, have you guys done a B12? Yes, I've done that. Well, have you checked the methylmalonic acid? No, I don't know what that is. It's because functional medicine is different than traditional medicine.
Right.
So again, doing functional tests goes far beyond just the standard blood test. So yes, you are correct. We do look at things like intracellular levels of nutrients. So we're looking at not just B12 and all that. We're also looking at minerals. We're looking to see if you have those in the cells or not. Do you have intracellular levels of things like mercury, lead, aluminum, cadmium, arsenic? All the different heavy metals. What about those? What about the ratio of calcium to magnesium? Does that matter? Yes, it does. What
Right.
about phosphorus to calcium? Yes, that matters too, especially when it comes to bone health. What
Right.
about the cell membranes? Are they healthy? Do you have the right amount of fatty acids in the membranes of your cells? The omega-3 to 6 ratio. Do you have the right ratio? Do you have phospholipids on the outside of the cell membrane that lets these things go in and out? So getting that gas from the tank to the engine,
Right.
you've got to be able to move through the cell membrane. And if
Mhm.
you can't do that, you've got a huge issue. And you have to address that first because honestly, if you think about it, to get something into a cell, what does it have to go through? What has to get into your mouth, into your stomach, through the into the blood, and then it has to cross into these cell membranes to get
Right.
into the mitochondria to make ATP energy and make these cell processes work. How does it get there? It has to go through the cell membrane. If the cell membrane is too stiff, you're not going to get it in there. And if it's too stiff, it won't let toxins out. You get these things trapped in there. You get this energy potential that's not there anymore in the cell membrane, and that leads to a lot of disease processes.
Mhm.
So we're looking for those. We're looking for the cell membrane health. We're doing fatty acid testing to see what these fatty acids, the ratios are or not. We're going to the level that no other traditional doctor, I don't think, will go to because they just haven't been taught that way. And I wasn't taught that way. I know that because I went to medical school and I felt like I got a great education, but
Right.
I never heard about these things before.
Yeah.
So that's kind of giving you some of the, but I think if you go down to the bottom line, it's all about thinking about functional medicine and its functional testing. Don't go to a functional practitioner that does do functional testing. If you do that, you're probably being misled. They're calling themselves functional, but they think functional, but they're not testing the right way. There's so much more to do, and that's why I think that's why we're getting the results that other people can't.
Well, and what was interesting to me too was the testing ranges are different also. So what would be within range maybe in the traditional model is not necessarily
Yes.
optimal in the functional model.
Correct.
Uh,
That's one of the big things that I think a lot of people are misled by.
right.
I can tell you, I've seen a lot of patients come from doctors that are really good doctors, and they say they have a normal vitamin D level, right? And you've heard of this
Right.
because normal levels on lab tests is 30 to 100. That is the
Optimal is
standard.
around 80.
Right, right.
Yeah.
Yeah, if you can, if it now, so for us, what's a normal lab for vitamin D? It's 60 to 100.
Mhm.
So yes, 80 would be right in the middle.
Yeah.
But what if you're 45 and you come into us and you say, "Oh, well, I've had my vitamin D checked. I don't need to check it because it was normal." I'm going to tell you what was the number. I'm going to say, "What was the number?" And you're going to say 45. I'm going to say you're too low. And
Yeah.
they're going to say, "Well, wait a minute. That's what my doctor said it was all right." Well, because your doctor's doing the standard deviations of 5% on either side of this equation of the standard deviations, which include 95% of the population,
Mhm.
which includes healthy and unhealthy people. Well,
Sure.
let's separate the healthy people out and see what their levels are.
Right.
Okay, now it's 60 to 100. Okay, now I know what healthy range is.
Right.
So that occurs not just with vitamins and minerals, but about thyroid and all kinds of other tests. So if you know what the healthy range is and you're outside that range, let's try to get you to that range.
And it seems to be sometimes that's kind of that missing link, right? So they've had these tests done before and like, okay, I'm in range here, but not optimal. And that
Not all.
range is a little smaller on the functional model. And then if we can kind of get into that space,
Right.
then you start to see a little bit more results or at least
Exactly.
feeling better.
Well, you will feel better. And honest, and you know this. So
Yeah.
if your thyroid was within the range of the TS, and many times you know this, doctors check TSH and T4. That's the
Hmm.
standard. Do a TSH and reflex the T4. If the TSH is abnormal, we're going to do a T4, which is, it's crazy because the T4 is made by the thyroid gland, but the T3 is the active form. It's made actually in the gut and the liver. So that process have to occur. So you should
Yeah.
at least check the T3. So, but regardless.
Right.
If you have a range for you as an individual that it has to be this wide, but this normal range is this wide, but you need to be somewhere along that pathway.
Mhm.
Where is your normal, Brandy? Are you under a lot of stress? Then probably you need more thyroid hormone. Okay. If your lifestyle and you're moving around everywhere and you've got a job that's changing and you have all these things
Are you
occurring,
being specific?
I'm saying that your need for thyroid hormone is
Yeah.
different than somebody that is a couch potato that doesn't really have anything that they have to do every day.
Yeah.
And so that's the difference between what we do. We're looking at you as an individual, giving you precision medicine
Right.
based on you only, and
Hmm.
using genetics, your genetics, and also the other pieces of the puzzle that we talked about that we've overturned to put the puzzle pieces on the inside once we found out the framework, and then we can tell you what works for you and what doesn't. It's not simple as just looking at a lab test.
No, and it kind of just burns down the idea of one size fits all care or
Yes,
medicine, which always seemed really odd to me.
yes,
Um, Primarily because I have this book that sits on my bookshelf in my office, which obviously I'm not in my office right now, Biochemical Individuality.
I
It
love
just,
that.
you know what I mean? It
Yes,
seems so obvious that one size fits all medicine was never going to work.
never.
Um, in general, the way that I care for my body is going to be different than how Josh cares for his. His needs are going to be different than mine. His genetics are going to be different than mine.
Yes,
Or my mom, though we're genetically linked, her issues are going to be different than mine. We're not going to care for our bodies the same way. Um,
right.
and it's an interesting way to exist and live. I will say most people in my bubble, they understand how I operate now. They don't necessarily get on board.
Yeah,
But I have a very strict diet. I don't consume alcohol or most inflammatory substances. I
can't.
try to avoid it at all costs. Sugar, I limit but do not. I'm still, I need to get there. But in
Yes.
general, I have very strict things that I do not stray from. And it's just the way that it is, just because I know it works for me specifically, and I'm not
Well,
asking
that yeah,
anybody else to do it, but
it's supporting your weaknesses that you've been told to
correct.
have. And so some people can get away with having wine and drinking and then eating dessert at every meal, right?
Yeah,
Some people cannot. You're on one of those that cannot. And so when that's the case and you know it, that's a game changer for you. Honestly,
100%.
that's really awesome because now you know what you can do to help yourself.
It's just hacking. So then that kind of gets me into the stage of life that I'm in now, and I think Josh and I both, is longevity, which is also, I would say, something that your practice supports. Is
Yeah,
okay, I come in, I don't have any particular ailments that I'm complaining about, but I want to go into my formative years with longevity, energy, all of that. What can I do? So let's talk
right.
a little bit about that. Somebody comes in just for longevity purposes.
Yes, and I think that if you don't talk like that, you're probably setting yourself up for failure.
Sure.
Because longevity over time is a combination of many things that add together that slowly start to erode the basis of your health pathway.
Hmm.
And we don't want that because what we want is a good solid foundation, which can then set you up to build upon as you get farther along in life,
Right.
so that when your needs do change, you're able to adapt to that. So,
Hmm.
hormesis, these different processes that occur in your body's ability to change and adapt with certain changes in lifestyle and
Right.
as you age matters because our mitochondria, as they change, we needed to address that because
Hmm.
if you don't, then that can weaken as time goes on. And now we even hear, the Nobel Prize is awarded for mitochondrial research showing that mitochondrial weakness can be the basis of disease, including cancer.
Sure.
So when we know that, the things that we can do in our practice to support mitochondrial energy over a long period of time. Now, there's a lot of research going on in longevity. Dave Asprey and some of these guys are out there talking about this, and honestly, I do follow them, and I do believe there's a lot to be said about using NAD and mitochondrial research, but there's the basics as well that we
Hmm.
cannot overlook. Energy comes from your body. You're an energetic being. Your body requires electrons to be moving throughout the body to function normally. When anything starts blocking that pathway, you need to do things to kind of support and help that pathway to succeed. In other words, if we know that energy comes from the earth, go out there and do some grounding. And
Hmm.
if you're doing some grounding and you're trying to age healthy over time, that's probably one of the easiest, the least expensive things you can do.
Right.
Put your feet on the ground. Get
Hmm.
the sunshine from the sun that comes into your eyes, the UV radiation that your body use to make things in your body work properly. Get that every day as much as you can. We live in the Northeast. It's kind of dark in the wintertime, so we have to help that along a little bit. So, but still, that you can't ignore the basics. So when somebody comes to me and says, "Doc, I'm healthy," and I have a lot of patients like that, by the way, I
Yeah.
have no issues. You know what I tell them? Congratulations. You are on you have got to this point in your life with no issues whatsoever. You know
Yeah.
what? That's amazing. Thank God for that. Let's see if we can't keep it going that way.
Right.
Let's not be 80 years old and have a feeding tube and live in a nursing home.
Right.
Let's be 80 years old and be going somewhere with our grandkids and flying on a plane, and you're lifting your own baggage up into the overhead bin.
Sure.
That to me is a win. And if we can get you to that point, yes, we can help it. And there's many, many things. You call them biohacking, you can call it whatever you want. I don't care what the term is. It's all about supporting these processes that God gave us. We don't have to age with pain. A lot of people think, oh, it's just part of aging. I'm
Right.
just getting older. I don't like to hear that. And I tell people that's not true. I mean, I know people that are 90 years old that are on no medicines. They work out every day. They walk, they ride bicycles, they go places, they do things. You can be just like that.
Right.
I mean, and it's not brain, surgery depth of knowledge that gets you there. It's basics. And if we can teach
Well,
you the basics, it can help.
not to mention the economics but behind kind of the care that it's going to take for a certain generation who is sick and or a generation coming up that is chronically ill.
Right.
Meaning if we don't kind of nip these things in the bud, work with longevity for the older generation or as we age, but also kind of deal with the chronic issues that we're seeing right now. I mean, my kids' classes look very different than the classes of children that, I grew up with as far as chronic disease.
Right.
Um, and so I can't imagine what the economics of that is going to be like here in another decade.
Yeah, it's kind of mind blowing if you think about it. And you hear Casey Means and people talking about that now
Sure.
and how we're drawing attention to the fact that our diets and our lifestyle has led us to a point that we have the sickest generations now that have ever existed in our country.
Right.
And kids, now not living as long as their parents. I mean, when did that? I mean, this is crazy to me.
Well, and it's happening very rapidly because, like I said, I will be 43 at the end of this year. Um, it's rapid. It's very rapid. I've
What
noticed the changes.
We're in a toxic world. I mean,
Sure.
we're being bombarded by all kinds of bad stuff from air, water, and food to EMF to everything else. And we're not doing anything to try to prevent that. And
Sure.
when we see a patient that wants to age healthy and gracefully, we're looking at all of those factors. We're looking at their air that they breathe. We're looking at the water that they drink. We're looking at the food that they put in their body every day. We're
Yeah.
looking at their EMF exposure. We're teaching them how to reduce stress in their life. We're teaching them how to compensate for these things which can lead to problems down the road. And if they do those things, I will tell you that the number one thing that they can do to prolong life is keep their mitochondria as strong as possible. We now know that you don't die when your heart stops beating or your brain stops functioning. You die when your mitochondria quit working at a certain efficiency, which I think they said is about 60%. And
Mm,
when that happens, then your body ceases to exist anymore. So
yeah.
if we can focus on supplying energy to the mitochondria through the cell membranes, through this electron potential, using the things first that God gave us, air, water, food, light, grounding, all those things, if we can teach you how to do that, you're going to have the best chance of prolonging life and having a life that doesn't require drugs. I mean, of course, if you are on medicines, we're going to help you to try to get off of those medicines if you
Sure.
can. And that's our one of our goals is to get you off of them and fill that freedom jar up, right? So we
Yes,
want
I
to do
love
that, but at the same time, there's little things that people do every day that they're hurting themselves and they don't even realize it. I mean, the water that they drink, it's just as simple as that even. Are you drinking clean water? And many times people never get asked that. I mean, when's the last time you go to the doctor and he says, "What kind of water do you drink?"
So it's funny you say that because the house, again, I moved again. So I went from Utah to Kansas. So I'm back in my home state, my original home state. Um, and the reason we bought the house that we did, or I did, Josh kind of let me pick the house, but it had a water filtration system, like a whole house water filtration system, and then an air quality. Um,
Yes, I love it.
filtration system, and what else do we have? All those like nerdy
Good.
things that nobody else would really care about.
I love that. Yes, that's a very important. And it's one of the first things we talk about the
Sure.
first visit. We ask you those kind of things. They're like,
Yeah.
what kind of water do you drink? I mean, and a
Yeah.
lot of people say, what do you mean by that? I drink out of the tap water or I drink out of bottled water. What kind of bottled water?
Sure.
Is it in plastic? Is it not in plastic? Well, have you ever heard of hydrogen? Have you ever drank hydrogen water? Do you know about hydrogen water? Do you know about reverse osmosis? Do you know about
Mhm.
distilled water? There's so many things to learn just about water that's why our visits are so long. I mean, it's so
Right.
hard to go through all of that, especially if you have, I would call them somebody that's never heard of any of this before, right? You weren't that way. You had already heard some of these
Yeah.
things. You were knowledgeable, but we have some patients that's never heard anything like that. It's like, well, I mean, how am I going to remember all this?
Sure.
So we now give out information with our patients when they leave. You get a folder that it tells you these are the guidelines. Here's your water that you should be drinking. Here's the food you should be eating. All these things that are basics. I've often told my wife I'm in the middle of writing a book about this and how I can hand it to people and say, here, this is your guide in the future about living healthy until you're 90 years old or beyond. And I truly believe, and I've been to, I'm a certified in longevity. And I feel like that the people that we see in our generation can actually live to be 120 years old and be healthy. I do feel like that could happen. And that's biblical. And I really feel like that is something that is one of our goals. I had one of my patients, he came to me, he said, "Are you a member of the 120 club?" And I said, "What do you mean by that?" And he goes, "Well, the people are going to live to be 120. Are you one of them?" And I said, "Well, I want to be one of
Well, I
them."
hope
And
so.
he's like, "Well, and he's a preacher. And he said, that's what the Bible says. You should be able to live to be 120. And he's a member. And I said, well, you're the founding member, and I'll be one of the members. And I'll see if I can get as many people signed up for you as you can to be a part of that club. And so, believe it or not, I'm hoping you're in that club too. But honestly, that's really important to me. And I feel like longevity is one of the spaces that we really excel at. We're using regeneration as part of that. So, talking about
Oh,
things like
yes.
I love talking about things like that and using peptides and stem cells and exosomes and all these things that now are out there. That's been around for a little bit now, and CDC has been dragging their feet a little bit about approving some of that stuff, but there are people using it, and I feel like that can really help people too.
Yes, well, I will say so. I also did an episode on stem cells. So you and it was after one of those really low moments. Um, I was, oh gosh, it was just it was post COVID. So I got COVID and it just spiraled me out of control. It took about 8 months from having COVID to kind of my bucket tipping. And I came into your office and that's the worst I had probably been in a 5 or 6 years, maybe. I hadn't slept. There was a lot going on in our life. So the stress was through the roof, absolutely through the roof. Um, and I was just a puddle. I was a puddle in your office.
I remember.
And yes, clearly Josh brought me. He was worried. Again, it was just a really, really crazy time. And you had said to me after we went through um, everything that we kind of needed to do to kind of get back on track, some testing we were going to do. My thyroid had obviously gone off the rails. I was hyper at that
Yep,
point, so just it was awful. Um, and so after going through all of that, you had said to me, I remember you had done stem cells in the past. Is that an option? And at the time, you weren't doing them.
yeah,
And it was a game changer for me just to get my body to cool off.
Mhm.
and just to calm things down. And it was an absolute game changer. And I remember telling this story. It was a physician has a specialty, and I won't pinpoint who it was or whatever, but I remember him calling it fringe, and I about lost
Right.
my mind. I about lost my mind. I didn't
Yeah.
sleep well for 2 nights. I was so mad
Oh my gosh. Fringe.
because it's just like, where are we right now?
Yeah.
That's something that is so helpful. And again, that was the second time that I had used stem cells. They were my own stem cells. It wasn't anything crazy. Had really, really, really put me back on track. Again, along with all the other things that I was doing, that you had helped me with, kind of
Yeah.
getting back on track. And it just,
Yeah. It's
oh my
amazing.
goodness, I was
There's
steam
yeah,
coming out of
there's
my ears.
oh, there's so many things that's available for people if they just knew
Yeah,
that it was available, right? That's
sure.
the part that we really and it's changing all the time, Brandy. I
Yeah,
go to conferences all the time now to keep up with all of this because it changes really fast.
sure.
And stem cell usage has changed. The types of cells, it used to be people had to travel out of the country to get stem cells. There was so many little nuances to it that made it very tricky.
Hmm.
Still frowned upon by medical, the FDA and different things because of certain things, and I understand that too. And of course, we would
Sure.
never, recommend people using, aborted fetal tissue
Oh,
for
of course
anything.
not. Yeah.
And so I feel like your own stem cells can be helpful.
Hmm.
I think there's times when your own stem cells may not be so helpful. Like, for example, if you're 90 years old
Right.
or 89 years old and you've got
So are your
80-year-old
stem
stem
cells.
cells, yeah, that's probably not going to help you too much.
Yeah.
And there are certain instances where people can use other types of cells and cell products. Now we're learning more and more about the other products that are come along with them,
Hmm.
like exosomes and different things like that, and what they do and how they work inside the body to stimulate your own stem cells to repair and regenerate.
Okay.
And then you throw into the mix the peptides and all the bioregulators and things that are out there nowadays too. And we're really in an interesting time in medicine where there's so many options for treatments for things that typically would no longer have any treatment at all. So chronic
Absolutely.
diseases and things like that. I've had anecdotal studies from patients that took stem cells and different things for and you were one of them, obviously.
Hmm.
But if you have chronic arthritis, rheumatoid arthritis that can be benefited by something like a stem cell infusion, I
Yeah.
mean, why wouldn't you do that? I mean, I wouldn't discourage somebody, even if they said, well, is it approved? I would say no. But if you're willing to do that and take the chance of it maybe not working, would it be something that you would want to try?
Sure.
And these are things that we really want to keep on the radar because as things change through medicine, we want to keep track of it. Is
Right.
there a better way to do it? Is there a safe way? Is there an unsafe way? What is that? And I would never give anything to somebody that is risky.
Sure.
So now we're using things like ozone and hydrogen and different things like that, which we have been learning about. We use red light therapies and we use PEMF and just all different kinds of technology now. And we're finding huge changes in people's lab work, even in things like that, just from getting them on some of these therapies that nobody ever talks about,
Right.
which could be considered fringe, I guess you might call it, or whatever you want to call
Man.
that. But if it works for you, is it worth it? I don't care
Yeah.
what you call it. You can call it fringe, or you can call it miraculous, or you can call it, God sent. The whole thing
Sure.
is if it works for you, I'm for it. But I would obviously first do no harm, right? So we're
Right.
we're always testing and wondering and researching and knowing what's the right thing to do for the right patients.
Hmm.
Again, if you can do those kind of things and offer it to people and give them, again, back to the hope again,
Sure.
and addressing the why of their problem. And if you can do that, yep, there's hope.
And what was interesting about that time, when I was at my lowest, and I remember leaving there, and we had talked about me possibly doing the stem cells again, and you said, look, if that doesn't work, we can try peptides. Or I mean, we talked about all of these different options, and I went home, and again, I hadn't slept. I'd had insomnia for a couple days, and I mean, delirious and just at my lowest. And I slept that night. I think I walked out of there with some CBD oil too, so maybe that helped.
Yeah,
I
yeah.
don't know. Um,
Calm it
but it
down a
was
little.
almost like it was the hope part of it, that okay, I have a plan.
Yeah.
And if this doesn't work out, then I can try this.
Yes.
And again, I'm one that whatever I try, I want to track it with blood work and other things. I want to know that's what was working. So I try not to do a whole lot all at once because I don't know what works. So it was one of those things when I did the stem cells, I wasn't really doing much else because I wanted to know if that
That-
was working or if it was something else that was
yeah.
working.
I agree.
So for me, that's just kind of how I operate. But yeah, it was really personally very helpful. Like I said, I've done an episode on it with the physician that did it for me this last time. Again, I've done it twice, but I guess the point is there are options for healing and are they're plentiful. They're plentiful.
100%. Yeah, and many times they're not known by the traditional medicine
Sure.
world. And that's the part that's, where we're coming into play
Right.
is I am a physician. I mean, there's a lot of people that come to me because I'm a doctor. I am a physician. I've been trained as a traditional doctor. I
Mhm.
understand medications and treatment protocols from that world. I've been in it for a long, long time. But
Yeah.
now I can offer you the additional knowledge about things that are not in that world all the
Right.
time, and things like peptides and things. And now I think they will eventually be part of that world. I do think that's going to happen. I think that we now know there are uses for stem cells in traditional medicine
Sure.
for bone marrow cancers and things like that. And I think there's many, many other uses for stem cells and other things like hydrogen and things like that. You
Right.
can research, just take hydrogen for an example. Type in hydrogen in Google and type your condition, and you'll see there's a treatment with hydrogen for it.
Right.
And because it's a selective antioxidant, it helps the redox potential in your cells, going back to that energy medicine that we talked about earlier.
Right.
And if you can address those issues, you can a lot of times get help that you can't get any other way.
Yeah.
And that's why I think that it is important to keep track. And you need to go to a doctor or a physician or somebody that understands these alternative things, because traditional medicine is just not equipped to deal with chronic problems. I mean, they're really not.
Yeah. No, I mean, you're right. And I think it's skyrocketed so much. I remember my my youngest, I had taken him to the pediatrician for something and we were talking about, I said, look, we have kind of this autoimmunity in my family. My mother is dealing with some autoimmune processes. We kind of have these chronic health conditions. I just want to be really mindful with his health specifically, kind of with those early interventions. And he said to me, he's like, "Oh, that's not even a big deal. It's so prevalent right now that we don't even worry about it." And I was like, "Wait a minute.
No.
Wait. Wait, it's
Yeah.
so chronic that we don't worry about it."
No, that's bad.
Wild. It was
Yeah, that's
absolutely
crazy.
wild.
That's bad thinking. And that's why we're in the position we're in now
Yeah.
with medicine. And that's why people are skeptical. And that's why people are looking for alternatives. And that's why we're so busy. And, I think that in the end, you're right. I mean, you can't just overlook things and think
Yeah.
that it's going to be okay. You need somebody that's really focused on the details,
Right.
because details matter when it comes to your health.
Sure.
If there's one little thing that's causing an issue in your body and you don't address that one little thing, which can be very easy to fix, by the way,
Yeah.
then it could potentially lead to a problem which could be very detrimental down
Very.
the road.
Yeah, it's a hole that's hard to dig out of once you're kind of down that really
Yeah.
far down that path for
And how
sure.
many people with Alzheimer's disease in their family, and now we know there is a genetic component to that, that have heavy metal toxicities like aluminum, and they're putting in their body every day. They use aluminum foil, they're getting vaccinations that have aluminum, they're doing things that are putting these heavy metal toxicities into their body, and then we find out they can't detox. In other words, they're a poor methylator. They can't make glutathione. Their body doesn't detox heavy metals, and we test them and find, yes, they do have heavy metals. If you've got the genetics for Alzheimer's and a family history for Alzheimer's, and you're
Yeah.
continually putting aluminum in your body through deodorant under the arm or whatever it's caused, where it's coming from, you're just setting yourself up for failure.
Right.
And
Which
there's
goes
no need
back to the
for that.
blueprint and how important that is.
The
Just kind of
blueprint, exactly,
understanding, yeah, your genetic
exactly.
blueprint. So, to wrap up here, there's a couple other questions that I have. You have so you said that what from 20 some states and other countries come see you. Do other physicians come see you?
Yes, we have several. I cannot tell you how many healthcare providers I have in my practice that are my patients. And that is the part that shocked me the most.
That is interesting.
And it all started back when I was working in the emergency room. I'd started this practice already. I was still
Yeah.
working in the emergency room. It was during flu season, and this doctor stopped me in the hallway at the hospital, and he said, "Dr. Turner, can I ask you a question?" And I said, "Go ahead." He said, "Why are you never sick?" He goes, "I get sick every year." He goes, "Flu comes around, I get it. I had pneumonia last week. I'm just getting over that. I mean,
Mhm.
every time I turn around, I'm sick." And I said, "My medicine is different than your medicine." And that's where I told him, he looked at me with a funny look on his face, and I said, "You want to know about it?" I said, "Come see me. I'll be glad to give you all the details." And so that's how it's a snowball effect. When healthcare providers that work in the system know that they can't get well, like another example, had a guy from Philadelphia come to me with hypertension, and he's a doctor. And I had no idea he was a doctor. He came in, he sat down, I said, "Why are you here?" He said, "I have hypertension. I'm on two medicines." I said, "What was your blood pressure?" We checked it. It was like 150 over something. He says, "Too high. I
Mhm.
can't get it any lower. I've done everything. I don't know how to get it better." And I said, "What do you do for a living? Are you under a lot of stress?" He goes, "I'm a doctor." And I was like, "Oh my gosh, this is crazy. You're a doctor and you can't even you can't even fix the hypertension." And
Sure.
I said, I asked one simple question to him, and this kind of points to the reason why. I said, "Why do you have hypertension?" And he thought about it and he goes, "Honestly, I don't really know." I said, "Well, if you could figure out the why, again, your why question
Right.
that you asked, if you could figure out the why, you can fix it." So
Right.
when healthcare providers started coming to me with these kind of issues, and he was a kind of an interesting guy, and he bet me that I couldn't help him and all this kind of stuff, and I took the bet, and I
It's
said,
his
"Look, I
medicine
think
in the
I can
freedom
help."
jar, by the way.
Yeah, now he's no longer on any medicine. Just fast forward, he's no longer on any medicine. He lost 20 pounds once he started coming to us. He texted me tw 2 months after he came to me, and he said, "Guess what, doc?" And I said, "What?" He goes, "I'm off of my medicine." I said, "That is impossible. How'd you get off of it so fast?" Because I did what you told me,
Yeah.
and I love that. It was like, it's this is why I do what I do. And then you know what I told him? I said, "You owe me because we made a bet, and you're gonna
Yeah.
have to give me a podcast or something to tell me." As a doctor, how you got better in this practice. And
Yeah.
so when healthcare providers started coming to me, Brandy, I was shocked, honestly. I have a
Sure.
gastroenterologist coming, internists that come to me, anesthesiologists that come to me, family practitioners that come to me, and I'm doctoring them. And
Yeah.
they're learning from me some things that they can help their patients with, which is totally fine to me. I love that. Take it, use it. You know, God didn't give me this for to keep all to myself. Go do it. When you
Yeah.
tell me you give patients vitamin D, do you give them the right kind of vitamin D? How
Sure.
do you check it? Do you check it through normal means or you check it through a different means? How do you know they're absorbing the vitamin D? These are things that I've asked all these doctors, and they had problems with it. And once they figure it out, they're like, "Oh my gosh, I wish I'd have got taught that in medical school." I'll never forget the one guy, he was a doctor, and he said, "Show me that methylation chart." You remember the chart, the
Yeah. Yeah,
methylation,
I
the
do.
chart?
Uh-huh.
And I showed it to him, and he goes, "That makes me mad." In fact, he didn't use those words. It was worse.
I'm sure.
That makes me mad. And I said, why does that bother you so much? He said, "Because nobody taught me that in
Yeah.
medical school. And I'm not a stupid person. I can learn that." He said, nobody ever showed it to me. I've never seen it before." And I said, "Don't feel bad, buddy. I'm the same way. I wasn't taught that in medical school either. It was only during my training as a fellowship in integrative medicine I learned this."
Yeah.
And it was such a game changer to him that he sends me patients all the time now. It's like why do you send it's crazy thing. But healthcare provider, nurses, nurse practitioners, chiropractors, dentists, doctors, they all come here to our practice.
That's amazing. And I think all that does is tell me that you're kind of sprinkling into the traditional healthcare system. And I think that's probably part of the process of changing it.
Yes.
So if practitioners are coming to you and seeing that it works, then hopefully that implementation or at least a mindset shift will
Yes.
happen. And I think that's all I've ever wanted. It was the whole reason I started the podcast. And I've talked about other things along the way, but it was the purpose originally was because I was angry that nobody was telling me the things that I needed to know to get better until they were. And then I
Yeah.
was mad. And then
Yeah.
I was mad that nobody else was talking about it.
Yeah. We go through.
And so I will continue to talk about it. And I think this just highlights a need, your success in this practice, helping me specifically. I will always be eternally grateful. And I think the last question or comment. Maybe you don't want to comment, but I'll give you the freedom to if you want to, is that your faith is extremely important in this realm, in this world. Walking into your office, it's very apparent that faith is a good portion of it. And you had said to me one time that no other doctor had ever said to me is, "Can I pray for you?" And again, it was at that appointment where I was at my absolute lowest, and I think it made me cry even harder just because that was kind of a caring missing piece. Even non-faithful people, I think, can appreciate that kind of level of care. So, can you speak to that just a little bit as we wrap up here?
Yeah, I think that that's a part of who we are, right? It's mind, body, and spirit. Spiritually, we are a spiritual being. This life is temporary, obviously. We're not going to live here forever. Charlie Kirk knew that, and you
Right.
can see all that now everywhere everywhere you turn on any social media or
Sure.
TV or whatever. And because of that, we have never neglected that part of our practice. That is something that who we are. If I was to try to prolong your life physically, but never address the spiritual side of things,
Right.
I don't think I'm doing my job. I feel like that people need to know that they are a spiritual being. If the only thing we have here is, 60, 80, or 100 years on this earth, and that's the end of it, how sad.
Right.
And I don't look at us as a body, with the spirit. I look at it as a spirit with the body. And
Mhm.
so when the body is no longer here, the spirit goes on. And so addressing that part of it is a big piece of the puzzle. And if we don't ever address that, I think we're missing a huge piece. And I'm never going to do that. Obviously, I feel like that's everything that we are and who we are and who we were created by. We have to go back to the manufacturer to get the best treatment. And the manufacturer was God himself. And if we can go back to that level and address it through that level, then you're going to get you're not going to take your Ford to the Ferrari dealership to get it repaired.
Right.
You're definitely going to go back to the manufacturer to do that. And God is he's the source of all life. And God is light, and God is energy, and God is all of that which he put into us. And if we can harness that energy that he gave us, and I would say Charlie Kirk made a big difference for a lot of people. It's going to continue. I think that ball has just been kicked even harder down the road now. It's going to continue to roll. It's going to build momentum, and I think in the end, all that's going to be really important. And it is who we are. So you are correct. When you walk in the office, you're going to feel it. And yes, I'm going to pray for you.
I love it. I think that's the perfect way to end this conversation. Like I said, it's been a long time coming. I hope that we can do it again. I think there's probably a lot more we could dig into, but I'm grateful for you. I'm grateful for your practice. Um, and hopefully your ball will continue to roll. I
Yes.
think the good works are only starting.
Well, thank you, Brandy. I appreciate you inviting me on here. I'm sorry it took so long to do it, but it is life has ways to throw you some curveballs. You've been through a few of those,
A few.
but you're doing good, and I'll continue to uplift everything that you guys are doing, and I'll pray for your family and you and Josh, and hopefully see him someday,
Oh,
and
yes. I'll
hope
get
we can
him
do
there.
this again sometime.
Thank you, Dr. Turner. I appreciate you.
All right, thank you.